Hi friends, welcome to Nurses Learning Guide. Today we're going to discuss about an interesting topic. It's in mallet finger, very common cases in orthopedic department. You will see the patient comes with a mallet finger or in the emergency department. So how we are going to apply the mallet finger splint? This is our topic today. Let's see how we're going to apply and what are the materials used for that, and what is the difference, and if we don't have a mallet finger splint, the next option, what will be the next option? It's like a ready-made splint. You can see it on, I'm holding it with me. So if you don't have like this kind of mallet finger splint, what you're going to do, all this we will discuss. Let's see how we are going to do it. So I have here different kind of material you can see, and the sizes also different sizes. It depends on the fingers where you're going to use the material. So you can see I have here fiber material and plastic material. So you may ask, what is the difference between the plastic and fiber? It's nothing. Fiber will be a little bit, you know, the shape and the structure designed. It is very soft material. So the patient, when we wear this on patient, will be more comfortable than the plastic. I'm not saying the plastic is very bad material, but I would go for fiber if I have it. If not, then you can go with this, but while applying you need to take an extra precaution. If there is any sharp edges or something kind of sharp edges, then you need to trim it a little bit while applying. Both will work, and its uses are same. The sizes, if you could look at, you can see the bigger sizes even available in the market. So you have to choose the right sizes. For choosing the size, you can see the numbers which is mentioned on the mallet splint. You can see number 2, number 3, number 7. The smallest size, what I know, they start from number 1, and which I'm holding is number 2, size number 2, which will be fitted on, you can see the little finger. Mine is a little bit bigger, so you need to choose the right size before you start applying it. So mine is number 3 is perfect for me. So the patient comes, you have to choose the right size before you start the procedure. For the mallet finger, you can see it, it will be like this, so you need to a little bit extend like this while applying. So the extension, you have to be very careful. You should not push it as very quick. So once you apply, you start pushing it gently like this. It should be in an extension mode. All right, so let's see how we are going to apply with the splint. And if you don't have the splint, ready-made splint, that also I will explain to you how to make a ready-made splint. So let's start with a ready-made splint. So I'm just holding size number 1. You can see it. As I told you, while choosing the size, you need to be very careful. It should be according to the size of the finger. You need to choose the correct size. So before we start applying, you could see that some kind of hole that it's for the air filtration. You can see that the holes. So if you apply directly on patient, what will happen once the patient comes back to the clinic for a removal, you could see some kind of stretching on the top of the skin. So in order to avoid all those things, I would prefer, if you have this kind of materials, it's called as a stockinette. The size is very smallest. For the finger, we have 1 inch. This is 1 inch. So before you apply the mallet splint, ready-made splint, you can apply this one and apply the mallet finger splint on top of it. So I'm applying it, and the rest of the size, you see this is a little bit lengthier, so you can cut short whatever the length which is required. So I applied the stockinette, you can see it. So what I'm gonna do, just hold it, okay, then insert this one very gently, because the patient will have pain due to this mallet issue. So you can see I'm pulling it downward. Okay, I'm just pulling it downward. So this part is very visible. It's nothing but you need to make sure that the tip of the finger is visible for the blood circulation. The patient should see it. In case of bluishness and cyanosis happen, the patient needs to come back to the emergency department or orthopedic department to release the brace and put it back. So just make sure the tip is visible always. Then what you're going to do, If you want to pull it back like this and put the just make sure that you will put the tape. So the tape which I am using, you can see that this is very silky tape. You can use whatever available in the department. So you need to put it like this. So we need to apply 3 tapes to secure it properly, or if you have a crepe bandage, you can apply on top of it. There is no issues in applying the crepe bandage. You can use the crepe bandage to secure it. Just make sure that it's in a tight position. Proper tightness should be given. If you apply the crepe bandage also, just make sure that the tip of the finger should be visible. That's only the thing. So this is a simple steps how you apply the mallet finger splint. It's a ready-made splint. You can see it's very tighty. It's not going to come off. So if you don't have a ready-made splint, then the next step is we can have our own tricks to make it. So let's see how we are going to make a mallet splint. So in case if you don't have a ready-made splint, what I'm going to use is, this is a normal casting splint. You can see that I just made it as a small. There is a piece inside. It's a casting splint. So just make sure that enough padding before you apply. Just make sure enough padding is there, because it should not be applied directly to the skin. So it should be there should be enough padding. You just hold it like this, and make sure that the position should be maintained. So the finger should be in an extension mode. You can see it. So you just hold it until you get the position. So once it's become hard, you can apply it with a bandage or crepe bandage or whatever available. I can show you. So you can see how we are doing it. You can see the extension. So you just hold it. So before the patient leaves, you just make sure there is no discoloration, and give the proper education to the patient what has to be done in case if the patient has bluish discoloration happened. They need to come back to their nearest emergency department or orthopedic department in order to remove and reapply it, and to see what happened, and to do the follow-up. So this is a simple tricks which we are using it if you don't have a ready-made splint in your department. So just make sure that you will apply it properly without any sharp edges. You can see it here as well. I padded very well. So our main point is here to give the extension, required extension. So you can see the mallet finger splint which we are applied. We have used both the techniques with the ready-made splint and how we are making it by ourselves. Hope you enjoyed the video. Let's see how we are going to apply this tricks which we are explained here. See you with another video very soon. It's me, Gijo, signing off from Nurses Learning Guide. Please do not forget to click the bell button, like and share. Thank you so much.